Good morning. Can you hear me?
Yes, sir.
Okay, good. So we can start. Right. So this basically mechanism of or mechanics of respiration is a combined lecture. So I will do the physiology part, and so anatomy department will do. I think Dr. Gunaratna will do the anatomy part. So as a intended learning outcome, let's change pointer. Right. So these are the ILOs of physiology part, and you can read it leisurely. Ventilation, right? It's very well manipulated process by the doctors, anesthetists, intensive care doctors. So ventilation, we can do ventilation artificially, right? We call artificial ventilation. So we can manipulate the mechanism, all the volumes and rates and everything we can manipulate or we can change when we connect a patient to a ventilator. So therefore, ventilator mechanism or mechanics of ventilation is something important when you are managing patients who is connected to a ventilator. So basically artificial ventilation in during anesthesia or during undergoing surgery or some patients, the days or months or years, they might be under ventilator, right? You know that well-known case of Jackson Anthony. He was connected to a ventilator for years. So we will learn about this mechanism, ventilator mechanisms in this lecture. And of course, that is the relevancy of this lecture for your clinical practice. Right. So when we consider about the respiration, we have something called internal respiration. You learn about the, even in the advanced level, in the cellular level respiration, we call utilization oxygen and then production of carbon dioxide. That is internal respiration, which will occur in the cellular level. But when we say respiration, basically we refer the external respiration. That means through the lungs, we absorb oxygen and remove carbon dioxide, or basically gas exchange. That the respiration that we refer. But remember, sometime in some places, the internal respiration, that is cellular level respiration, also can be referred as a respiration. But ventilation is not the respiration, right? So ventilation is actually, we can talk about the ventilation even in our home, in your room, in where you stay, right? So basically ventilation is the airflow, isn't it? In your room, if you say ventilation is poor, that means airflow is poor, right? In your lecture theater, lecture hall, if you see the ventilation is poor, that means airflow is poor. So in our body also, ventilation is the airflow. That means inspiration and expiration, right? So using inspiration, we will take air into the lung. Using expiration, we remove that air, right? Aswasa, praswasa in Sinhala. Of course, there should be a nice word in Tamil, right? So inspiration and expiration is the ventilation, but respiration is slightly different. It's related to gases, right? So we will learn about the ventilatory mechanisms or physiological aspect of ventilation in this lecture today. So physiology part is short and anatomy will continue, right? So when we say mechanics, the arrangement of this lung is important, right? So we know these are lungs, two lungs. They are inside the chest, right? Covered with chest wall, right? So chest wall consists of intercostal muscles, ribs, and so several layers you will learn in anatomy. So inside this lungs, right? So lungs is the organ we can see inside the chest wall. Lung is covered with several layers, right? We call pleura. Actually, there are two types of pleura. Visceral pleura and parietal pleura. You can see this is the lung, and this is the inner layer of pleura we call visceral pleura, and outer layer we call parietal pleura, and there's a small cavity in between that we call pleural cavity, right? So that these two layer of, that means visceral pleura and parietal pleura, are actually very thin layers. They are attached to each other. So if I draw something like this, let's say this is the lung, right? And these are two layers of pleura. That means inner pleura and outer one, right? So there are very thin space between these two layers, right? So even we say thin space, actually these two layers attach to each other. Hmm? So then we cannot call it a space. So therefore we call it a potential space. There is a space and there is no space, right? Tino space, right? So really there is no real space, but therefore we call it a potential space. So pleural cavity is a potential space. We can talk about the pressure inside this space, right? And these two layers attach each other and can contain some fluid layer in between that. So there's a fluid layer and attached to each other, but they can move each other, but they cannot separate. Remember, they cannot move apart, but they can move each other, right? So it's like probably you can understand two glass slides with thin water layer, very difficult to separate, but they can move each other. So pleural space also similar. Of course, it's not glass, it's a some sort of tissue layer, movable. And we can talk about the pressure inside this space. And but since these two layers are attached to each other with a very thin layer of water, we can call it a potential space. Right. So here we have lung. So this is the lung, and these are this interpleural space where two layer. And so outside there we have chest wall. Here we have chest wall, or in this side we have chest wall with the muscles and ribs and so on, right? So this, as you know, chest wall can expand. Basically, this chest wall can move outside with the action of intercostal muscles and diaphragm, right? Probably you remember diaphragm, Mahaprachirya in Sinhala, intercostal muscles. So basically this can move out, right? When this move out, of course, volume increase in the thoracic cavity, right? When volume increase, what will happen to the pressure? Anywhere? When volume increase in a space, what will happen to the pressure?
Decrease.
Pressure decrease. So when it's move outward, not only chest wall, diaphragm also, pressure decrease in the thoracic cavity. So pressure in whole this cavity reduce. Especially pressure in the interthoracic space reduce, right? Volume increase, pressure reduce. Then something should happen. I will explain in next slides. We'll erase this. Right. So here, as you can see, when the chest wall expand and diaphragm go down, volume increase. When the volume increase, of course, pressure will reduce, and when the pressure will reduce, there will be a pressure gradient from outside to inside, and air will move. Right? So this pressure reduction is actually in the lungs. We can talk about the mainly two types of pressure. Intra-alveolar pressure. That means if I draw again, so here let's say we have trachea and divide into branches, right? And further branches, further branches, further branches, and finally we have alveoli. You learn in Sinhala Gartha, right? So I use Sinhala term just to refresh your advanced level knowledge. Unfortunately, I don't know Tamil term. So sorry about that, but I will not teach in Sinhala, but I just use sometime Sinhala word just to make it refer to your advanced level knowledge. So this is the alveolar space, right? So in the outside this whole lung, we have interpleural space, right? So when we think about the volume increase, of course, pressure should change or basically reduce. So we use pressure in the two places. One is interpleural pressure and other one is intra-alveolar pressure, right? So we use these two values to describe the mechanism of ventilation, interpleural pressure and intra-alveolar pressure. Of course, both will reduce, not the same value, right? So with the expansion of thoracic wall, interpleural pressure will reduce and intra-alveolar pressure also reduce. That means pressure inside the alveoli also reduce, right? Right. So let's see how it's reduced in next slides. Right. So take use this diagram. We will use this diagram to explain this. And this is interpleural space, right? And the interpleural pressure is not same from bottom of the lungs or from bottom to top. It's not same. So bottom pressure in interpleural pressure in the bottom is higher and the top or apex of the lungs interpleural pressure is low, right? This interpleural pressure is below the atmospheric pressure, right? What is the atmospheric pressure of the sea level? වායුගෝලයේ පීඩනය කීයද මුහුදු මට්ටමේදී? Atmospheric pressure in sea level? Physics?
76 mercury millimeters.
Sorry?
76 mercury
76,
millimeters.
okay. 76 mercury millimeters, right? Mercury millimeters, Hg, right? So that's the atmospheric pressure. This interpleural pressure is below the atmospheric pressure. So it's a minus value. Mean we consider this atmospheric pressure as a zero, right? If the atmospheric pressure is zero, this value is minus, right? So interpleural pressure is minus. That means interpleural pressure is less than 760 millimeter. Let's say 755 or 58 or something, right? But in this description, I use it's a minus 1, 2 or 10 because that minus mean it's below the atmospheric pressure and considering this value as a zero, right? So before we start the inspiration, that means before we expand our lungs, right? Before we expand the upper lung or before inspiration, asvasa, before we take air into the chest wall, in the bases, interpleural pressure in the bases is, we consider minus 2 or 2.5. Let's say -2. But in the same situation, above value is about -10. Was -10. Here -2. Which pressure is high? Base so top. Interpleural pressure. කොයකද වැඩි?
Base.
Yes, base. Because this is -10, this is -2. Right? More minus mean වැඩිද අඩුද? More minus mean වැඩිද අඩුද?
Adu.
Adui. Yes, Adui. Good. Right. So more minus mean less pressure, right? So don't confuse, and try, I will try. I try to explain. Otherwise, this value might confuse you. So here -2 and here -10. Before we really start the inspiration, before we really expand our lung, then we expand the lung, chest wall, chest muscle, intercostal muscle, diaphragm contract, and this will of course increase the volume, and with the increased volume, pressure will reduce, right? So this, consider about the base value as in this example 2.5 base value. So when thoracic wall expand, this -2.5 get more minus, that means reduction of the pressure, it can go to -6, more minus, that means reduction, right? So interpleural pressure will be -6. Here you can see this is inspiration. Just concentrate only this graph. Interpleural pressure at the beginning it's -2.5, and it will reduce or go down and go to the -6, because pressure reduce, minus value increase. I repeat, pressure reduce and minus value increase, -6. Of course, because it's a volume expansion and pressure should reduce. So when pressure reduce in the interpleural pressure, interpleural space, and of course volume expand in the whole lung, volume of the alveoli also expand. And of course pressure in the alveoli also reduce. So at the beginning, alveolar pressure is atmospheric pressure. At the beginning of inspiration, alveolar pressure, let's say just draw alveolar here, right? Alveolar is connected to respiratory tract. So pressure here is exactly the same of atmospheric pressure. There's therefore no pressure gradient before, I mean, just when we start inspiration. Chest wall expand, when we try to initiate the chest wall expansion, alveolar pressure is 0. That means atmospheric pressure, this value. So since alveolar volume also expand, alveolar pressure reduce. And here in this part, in this graph, it's a alveolar pressure, right? Pressure in the alveoli. This. So at the beginning it's 0, and then it start to going down during inspiration. When we expand the chest wall, right? When we expand the chest wall, alveolar pressure is going down, interpleural pressure also going down. Okay, because it's a volume expansion. But it's not same pressure, remember that, right? It's not same pressure. So this value, the interpleural pressure is lower value. Right? At the beginning also it's lower, -2.5 and -6. This one at the beginning is 0 atmospheric pressure, and it's come to a -1 because of the volume expansion. So in the intraalveolar pressure, when it get -1, that means lower than the atmospheric pressure, what should happen? This pressure is below the atmospheric pressure. What should happen? And remember, it's connected to all the way to the trachea and outside and all the way to external world. So what should happen? Huh?
Air should flow into the lungs.
Yes, air should flow into the lung because now there is a pressure gradient. Of course, pressure gradient is very low, 1 mercury millimeter, but air should flow, right? So air with the inspiration, air flow will start during inspiration, right? Air flow will start during inspiration. Air will enter into the alveoli and lung will fill with air. That's what happened in the inspiration, right? So when the air flow into the alveoli, what will happen to the pressure inside this alveoli? When they are coming?
Increases.
Increases. Pressure should increases. So pressure should increases. That means pressure will come to the -1 and airflow establish, and then gradually it start to increase because air is coming. But remember, still lung is in the inspiration position. Lung is still expand. Interpleural pressure is still minus value, -6. So lower than this initial value. But now intraalveolar pressure increase because of the airflow. So remember, in the middle of the inspiration, this is the inspiration. This is the inspiration. In the middle of inspiration, intraalveolar pressure come to the lowest value, that means -1, and then start to increase. But still it's in the inspiration, it's still in intraalveolar pressure is low, interpleural pressure is low, still chest wall expand, still in the inspiration. But intraalveolar pressure is start to increase even in the inspiration because of the airflow. And so at the end of the inspiration, intraalveolar pressure come to the 0. Here, at the end of the inspiration, intraalveolar pressure come to the 0, but intrapleural pressure is still low, -6. Basis it's -6. Lungs expanded because still it's in inspiration, but airflow stop. Why airflow? What's the reason for why airflow stop here?
No pressure
Because
gradient.
No pressure gradient. Intraalveolar pressure, this pressure and outside pressure same. Pressure stop. So when it come to here, actually inspiration end. Inspiration end. Right? And the lungs fill with air. Lung expanded and filled with air. Intercostal muscle, diaphragms contract and give full effort to keep the lung expand. Right. So when the lung expand, interesting thing will occur. Lungs are elastic. Lungs consist of elastic tissue. Let's say this is lungs. This is other lung. This lung is made of elastic tissue. Some sort of elastic tissue. We call recoil. What's the quality of elastic? What's the quality of elastic? Very common use of elastic is in underwears, right? So we can expand using force, but when we remove the force, what will happen to the elastic?
recoil.
They will come to the original position. Rubber band we can stretch the rubber band, and when we release it, it will go to the original position. right? So underwear also same. We can expand and put it and wear, and probably it will go back to original position. When we remove and put it to the rack, it will go to the original position. දැන් ඉන්නකොට තමයි තද වෙලා තියෙන්නේ. Because pressure. So lungs also elastic thing. We put a effort, intercostal muscles and thoracic diaphragm, and this effort expand the lungs. Expansion is due to this two layers cannot separate. So when you apply pressure to the chest wall, right, in this direction, when we apply pressure to the chest wall, this one also move with that, because this two layer cannot separate. That's very important. Two layers, visceral and parietal pleura, cannot separate. So therefore, when the parietal pleura move with the chest wall, visceral pleura also move and lungs expand. Lungs will expand and get the volume expansion. But we cannot keep that forever, right? So we put the effort with the expiratory muscle, inspiratory muscles and diaphragm. But when lung expand, recoil pressure will act on the opposite direction. ඇකිලෙන්නව තමයි හදන්නේ. Lungs try to recoil, right? Try to come back to its original position, right? So we put a force to this direction with the muscles. Lungs elastic quality put a pressure to opposite direction and try to make it come to the original position. So at the end of the inspiration, these two forces balance each other. Balance means our effort, muscle effort, and elastic effort of the lung, so we call recoil pressure, come to equilibrium. And then beyond that, we cannot expand the lung. And so we stop the expansion and come to a end of the inspiration. End of the inspiration is here. When it comes to the end of the inspiration, lung expanded and interpleural pressure is -6 in the base and lung expanded. So in the next movement, we will relax our inspiratory muscle, diaphragm and intercostal muscle, we relax. When we relax them, that means we cut this force. We remove this force. Then what should happen if we remove this force? මොකද වෙන්න ඕනේ? Yeah, it will go back and recoil pressure will operate and lungs will collapse, so come to the original position and so on and so on. And that will decrease the intra-alveolar pressure, right? So in the quiet breathing, resting stage, there is no additional energy required for the expiration, and recoil quality or recoil pressure or elastic quality of the lungs will get it back to the original position and compress the lungs, and intra-alveolar pressure will increase. Then less negative, -6 to -3, the original level. Interpleural pressure increase, get all less negative, and same way intra-alveolar pressure also will increase the over the atmospheric pressure, get +1. Here it's a -1. +1 mean pressure gradient from inside this alveoli to outside. So air will flow, right? So that is what happened with the expiration, right? So inspiration, expand, alveolar pressure reduce, interpleural pressure increase, decrease, get less negative. And during expiration, recoil pressure overcome that force of chest wall and muscle power, and lungs will compress, volume reduce, pressure increase, interpleural pressure increase, get always negative intraalveolar pressure, and get over the atmospheric pressure. The same thing will happen. In the middle of the expiration, it come to the maximum intraalveolar pressure +1, and then going down because of the air is moving out. Right? So that is the ventilatory mechanism of the in human, and read this and try to understand what happened during inspiration and expiration. Right? So, so same thing that I explained already, expiratory aspect, right? And during inspiration, as I mentioned, we have muscle power to this direction, lungs recoil power to this direction. At the end of the inspiration, they will balance each other. During inspiration, muscle power is more. We put it back outward. So remember, there is a very small outward recoil pressure also from the chest wall. That will not help much. So at the end of the expiration, right, we remove all the air. What happened? Outward pressure of the chest wall and recoil pressure of the lungs, right, balance. And lungs come to a end of the expiration, ready for the next inspiratory cycle, right? This recoil pressure of the lungs and some very small value outward recoil pressure of the chest wall balance at the end of the expiration. Of course, lung is collapsed. Lungs is small, and that is end of the expiration, right? So this value here you can see water centimeter. Don't worry about the value. Just remember mercury millimeter value. This value, remember, minus 2.5, -6. Remember that value. Remember this value is in the lung basis. The value in the top is less. Right. So expiration during quiet breathing is passive process. As I mentioned, no muscle action required. Recoil pause of the lungs will do the job. Right. Very short contraction of inspiratory muscle during at the beginning of expiration also, just to prevent quick collapse of the lung. So quick pause of recoil pause of the lung. Even we mention it as a -6 value. Strong inspiratory effort can reduce interpleural pressure even to -30. If we put an extra effort for the inspiration, parima inspiration full effort with interpleural pressure will reduce to a very low value, right? And so about the action of muscles and these things you will learn in anatomy. Active contraction of extremity muscles might, of course, quiet breathing. Expiration is a passive process, no muscle action required. But if you want to do extra effort, extra expiration, right, during exercise, so when we do some extra activity, for the expiration also, we can put a muscle action. We have expiratory muscles, we can use them, and additional respiratory muscle also there. So we can use them. So expiration also can make an active process if you want extra air or when we are active, right? So diaphragm contributes 75% in for the inspiration, especially when you are lying down or sleeping, almost all the effect by the diaphragm, right? So action of intercostal muscles, you will learn 2 types of intercostal muscles and so on, you will learn in the anatomy, right? So this again, just to show that this is interalveolar pressure is, interpleural pressure is -2.5 somewhere here, but in the top it's about 10, right? And of course, that is interpleural pressure, lung volume change, this diagram, you can see shape of the base and shape of the apex or top is not same. Right. So when you learn about the compliance, we will talk about the pressure change and volume change, or volume change per unit pressure change, that is compliance. You will learn in the further lectures. But remember this curve and shape of this area and this area is not same. Make a angle. Probably you remember in advanced level, anukramane of this is not same. Right. So that's all for the physiology aspect, and I hope you will learn more in anatomy. And so I will end the lecture, and probably you will get some input from anatomy about the anatomical aspect. Right. Okay. So I will end now.